Everybody, at the outset, my sincere apologies for not being able to be present physically during the international conference of the Teleradiology and PAC system. Due to unavoidable reasons, I'm not able to be in the country at that time, and I particularly want to place on record my gratitude to Dr. Arjun Kalyanpur, not only for inviting me, but for agreeing to record this presentation offline. I belong to the BC era, before computers and before Christ are one and the same. And over the next 25 minutes, I will try to convince you that you would actually be doing malpractice in the year 2012, in the year 2013, if you do not practice digital healthcare. So ladies and gentlemen, I'm going to put you onto a time machine. Fasten your seatbelts. I'm going to take you with me on a journey which certainly is going to be bumpy, but I guarantee you a safe ride. Now, what actually is going to happen in the future? First, of course, we're going to have problems with technology, as I'm having now. I'm not able to get the next slide. Sorry about this. Now, let's look at the Indian healthcare jigsaw, as I call it. We have lots of problems. We have lack of last mile access. We have lack of organized delivery. We have lack of skilled manpower and so on. How can we achieve what we all want to do, namely to get, an equitable, sustainable, quality healthcare for 1 billion people? I think the only way we can do this is through technology-driven healthcare transformation. Ideally, as doctors, we would like to see a small number of people. This is how we would like to see on the left. But in reality, in our country, what you see is on the right: overcrowded outpatients, lack of enough doctors, maldistribution of doctors, and so on. This is the real world. Now, what is eHealth? The World Health Organization defines eHealth as all aspects of healthcare where information and communication technology is used. Today's doctor is not an island unto himself. We talk about consumer health systems, we talk about expert systems, electronic medical records, clinical trial systems, and so on. Like many other aspects of healthcare, we all start with pilot projects. Many of us maybe proceed to a proof of concept. But then there are very, very few people like Dr. Arjun Kalyankumar, who has not only developed a product, but has established it into a way of life and literally has incorporated it into the radiology system. Now, this is what needs to be done. Traditionally, the healthcare delivery model for the last 6,000 years, if you call it, has been directed at the bottom of the pyramid, that is the patient community. We all know about primary healthcare, the 620 districts in India. We have more than 36,000 primary healthcare centers. Then it goes to district hospitals, regional hospitals, medical colleges, and finally we end with, let's say, the All India Institute of Medical Sciences. There is a physical movement of patients from the bottom of the pyramid to the topmost. However, this has changed completely, and now what we see is some problems with the slides here. It's just not fun. The future health system transformation is, you see, the pyramid is going to be changed. We are going to have an informed, wired-up citizen community. Gone are the days of super specialists. We are going to talk about a very well-informed patient. We are going to talk about an empowered patient. We are going to talk about patients who are going to be more and more involved in the decision-making process, in the what is called do-it-yourself. We are going to talk about primary teleradiology and telepathology. We are going to talk about health kiosks, daycare surgery, community hospitals, and most important, direct access to specialists without going through the hierarchy which we were accustomed to. Ladies and gentlemen, there's going to be a paradigm shift in the way healthcare delivery is going to be practiced. Healthcare practices, roles are going to be changed. Nursing practitioners at the primary care, financial remuneration and rewards are going to be altered. A doctor is going to be employed by an HMO and he probably will be paid more or earn more if he operates a little less. Whose bread you eat, his song you must sing. And unfortunately, finance and economics cannot be dissociated with the way in which healthcare is delivered. Patients are going to be empowered. Today, believe it or not, 50% of the patients who are referred to me for highly sophisticated stereotactic radiosurgery probably know a little more of their disease and their various treatment options than I know myself, because at the click of a button, they are able to download every single bit of information. What are the trends in healthcare? The trends are DIY, do it yourself. And as you can see in this picture on the bottom right hand side, the day is not far off when an ultrasound probably will be done by the patient himself using a trainer's manual. Access to affordable quality care. Society will want patients to take responsibility of their care. Why should I check somebody's blood pressure? Why should I check somebody's blood sugar when he can do it himself? And if that is possible, why can't a patient take his own ECG? Why can't a patient check his own refractive error? Yesterday, I was looking at a mobile phone, MIT Boston, where through a mobile phone, you can test your own refractive error. Now, what are the main domains of eHealth? Clinical applications or electronic health record. In an hour from now, I will be giving a talk trying to convince the Indian bureaucracy that money invested in EMR is probably much more cost effective and much more useful to society than buying 5 Tesla MRI units or making available helicopter ambulances and quaternary care hospitals. 2 months ago, when I was listening to a talk by the health minister of Sweden, Sweden has decided that they are not going to build any more hospitals in the next 10 years. The health department feels that instead of building more hospitals, treatment should be done at the patient's house, in daycare units, and so on. So this is going to be the future. We are going to promote wellness. Just imagine, 90% of bypass surgeries which are done today could have been prevented in the first instance. I see at least one case of hypertensive intracerebral hematoma in a city like Madras every week, and all this because hypertension was not initially looked at. So promotion of wellness, prevention is going to be the order of the day. Lifetime health records along with the unique identity number, the Authority of India, talks are now progressing, and I am absolutely sure that within 10 years from now, they are not too far behind the West. Every Indian citizen, at least in urban India, will have an electronic medical record, and this will probably save much more lives than sophisticated intervention. We are talking of P4 medicine. What is P4? Predictive medicine. Science is making it possible for doctors to make accurate predictions. Just imagine an unborn baby. Today, for $350, you can test 25,000 genes in your 23 pairs of chromosomes. It's only a question of time before the cost comes down. And of course, in one way, the ethical issues are mind-boggling. Would you like to know that your unborn baby is going to get Alzheimer's disease 60 years from now? But this is the future. This is what is going to happen. Personalized medicine. You no longer are going to go to a pharmacy and buy chloromycetin or ampicillin. The drug will be tailor-made to suit based on your genome, and your genome will be made available to the pharmacy. All this is not science fiction. It's already started to happen, and in 10 years from now, it will certainly reach India. Preventive medicine, I've already mentioned about this. Participatory medicine, that is the fourth P. This allows an individual to participate in his own health, modify his behavior and lifestyle, and acquire control over his future health. What are the technology trends we see in healthcare? Towards the patient, increased patient responsibility and power, clinical convergence, diagnosis linked to therapy, and again, information driven. At the end of the day, it is information, information, and information. If all stakeholders, whether it be the patient, whether it be the doctor, whether it be the health policy maker, if he is given information, and that too in real time, and lots of lives can be saved. Now, if we look at HCIT or healthcare information technology, we are not looking at a doctor-patient interaction. Today, the healthcare is known as an industry, and it is one industry which is recession-proof. We are talking of medical knowledge management, we are talking as clinical trials management, India has already becoming the major country outside the US to do clinical trials. And in the next few years, this is only going to become more and more. And how does technology work? Very simple. The peripheral medical devices to measure simple things like temperature, weight, glucose, oxygen, etc., etc. All this through Bluetooth technology will be transferred to your mobile phone, from there to a server, and the server will decide, based on the information received, what is to be done, etc. We are thinking of the day when we will send reminders, notifications. The commonest cause for complications in diabetes, diabetic gangrene, amputation, diabetic retinopathy, is not lack of diagnosis, is not lack of treatment, but purely because lack of adherence and compliance. 40% of seizures seen by neurologists and neurosurgeons, seizures occur because the patient did not take medication. What we require is not sophisticated MRIs and ECGs, but simple methods to remind the patient to continue to take his medication, and this is where technology comes. SMS. There are any number of studies which have shown that by sending SMS, compliance and adherence dramatically increases. We are again talking of information searches, we are talking of trend analysis, we are talking of being able to retrieve vital signs. 64 years after Indian independence, India has no idea of the incidence and prevalence of brain tumors, of how many liver transplants does this country require, how many cardiac surgeons do we require, how many tertiary, quaternary care hospitals do we require. We just don't have solid data. With modern technology, we will be able to collect this data, retrieve this data, analyze the data. This is how the future is going to be. We are going to talk about integrated health services platform. You'll be wondering why a medical doctor should be talking of PSTN, CDMA, GSM, 4G, 5G, and so on. But this is what is going to happen. We are going to truly be integrated. IIT Kharagpur have already started the first master's degree in medical sciences for MBBS candidates. The first hospital is being built in IIT Kharagpur, and a few months ago we had a meeting. I was one of the invitees to the meeting. There is a discussion now in the Ministry of Health and the erstwhile Medical Council of India whether IITs should be allowed to start MBBS courses. This is the future. The gap between engineering, technology, healthcare and medicine is very, very thin. And I foresee that in 10 years from now, to be a medical doctor, at least to be a specialist in medicine, you must have a very good background in technology. Here you see on the left-hand side, we are talking of mobile health clinics, and we are very innovative. See, the Apollo hospitals a couple of years ago realized that ambulances, there's no point in having beautiful ambulances because these ambulances are not able to negotiate the small roads. So now in many tier 2 cities and towns in India, we have made two-wheeler ambulances which has got a defibrillator, an oxygen cylinder, and you can even do an endotracheal intubation. All these have been modified, these people have been taught, and again at the moment through 2G and edge technology, they're able to transfer the data. So this is the super highway we are talking about. Most of you are familiar with cloud computing, with SaaS, software as a service. It's going to be impossible for a doctor, for an individual doctor, for a nursing home, for a small hospital to be able to invest large amounts of money in buying software which is loaded onto the computer. So why not we go into cloud computing? And this is where the health highway, which has got its office in Bangalore, already 10,000 doctors are enrolled in this. And we hope in the next 10 years, there will be 100,000 doctors so that electronic medical records will be available. All this will be stored in cyberspace, and whenever you want it, you can retrieve it. Just imagine if your health records are available to you at the click of a button wherever you are, anywhere in the world. We are talking of a totally different ecosystem, right from the unborn, from antenatal pregnancy, infancy, childhood, adulthood, old age. This is what you're going to have. You're going to have mobile healthcare platforms, you are going to have triage, a command and control center, and so on. Now, I'm always fond of saying that there's been a tremendous transformation in healthcare. Gone are the days where healthcare was an individual doctor-patient relationship. Today, a doctor is only a small part of the link of a chain in which we require administrators, we require managers, We require IT specialists, legal specialists, and so on to carry out all this. We are talking of a triage. Why should a patient with a headache come to a neurosurgeon when the neurosurgeon has no time even to treat brain tumors? So we are going to have triage in a very sophisticated way, self-triage, tele-triage, etc. We are going to have paramedics who at the touch of a button will be able to have immediate access to whatever information a so-called specialist is able to have. Sorry, there seems to be some problems with the projection of the slide. Just not going to the next slide. Now, you would be forgiven 10 years ago if you thought that this was Houston NASA Mission Control Center. This is how the room of the COO, the Chief Operating Officer of Apollo Hospitals looks like. And this is the dashboard which he sees in his room. He keeps track of the 52 hospitals on a real-time basis. And obviously, as the months go by, the years go by, this is only going to become more and more. So this is what modern medicine is all about. We are talking of real-time alerts. Now, an example of a digital hospital which I downloaded from the net, General Electric, as early as 2003. You can see that a paperless hospital, after conversion, it is very difficult to convert a normal hospital into a digital hospital, but when you do it, you can see that adverse drug events reduced from 18 a month to 3 a month, medical administration errors reduced, and so on. And this was just in the first 4 days of institution of this. This is actually what happened in Oxford. Many of you must have heard of Nuffield and the infirmary hospital in Oxford. This is being broken down, and general hospitals in most Western countries are going to become a thing of the past, and so too in India. I don't think we're going to build 2,000-bedded hospitals, 3,000-bedded hospitals, though a couple of people seem to think so. The majority of hospitals are going to be small hospitals with more and more emphasis on domiciliary care. Now, I don't know whether you're able to see hear the movie. It's a pity this movie is not, I think it's not playing. Okay, doesn't matter. This is an echocardiogram, and which we started doing this as early as 2001, where from a village in Aragonda, the pediatric cardiologist at the Apollo telemedicine room was able to supervise an echocardiogram, and 250 pediatric echocardiograms were done and transmitted through ISDN line. As you can see here, this was as early as October 2001. I dream of the day in the not too distant future when we will be able to see the echocardiogram right on your mobile phone. Now, oral cancer. So this is one of the major problems in India, and to me it is very frustrating that for a one-time investment of 10,000 rupees, you can buy a camera like this, which has got a 5 megabyte storage capacity, and it's very simple just to put the camera inside your mouth and send it through wireless. You can send it to a specialist. The specialist will be able to precisely tell a nurse or a paramedical person where to take the biopsy from. Now, small things like this matter a lot. If you take the biopsy from the wrong area, the reports will be inconclusive. We have the world's highest incidence of cervical cancer. Every fourth woman in the world with cervical cancer lives in India. And again, colposcopy can be done like this. A smear can be taken if only the proper equipment is available. It's interesting that this article is published in JAMA. The leading cause of death in the United States, ladies and gentlemen, is not AIDS, is not cardiac diseases, is not stroke, not Alzheimer's, not cancer, but the U.S. healthcare system itself. It is the U.S. healthcare system which accounts for the largest single cause of death. And why? Adverse drug reactions, medical error, infection, malnutrition, unnecessary procedures, $122 billion spent. And this has been published in peer-reviewed journals. This doesn't mean that it does not happen in other countries. Obviously, if you put India, probably it's 10 times it. But then India, our ICT is not that well developed for us to retrieve or get this sort of information. But this is how technology or digital healthcare is not just a question of better diagnosis, better treatment, but the ability to look at what you're doing and the ability to change what you're doing completely. Now, Adverse drug event surveillance, all of us know as practicing clinicians that it is impossible for the human brain to store all the facts about drug-drug interaction. I prescribed 7 drugs, 8 drugs, not knowing that the drug number 3 is totally antagonistic to drug number 7 and drug number 4 and 6 potentiate each other and so on. So with the help of a PDA, with the help of a computer, we can spot out so many of the anti-drug effects. Again, look at this, how wonderful it would be if every clinician has this. The computer tells you if you suspect perforated free air, a chest PAVU and a KUB are recommended, etc., etc. Did you remember to find out if this lady is pregnant? What about her urea, creatinine, etc.? So these reminders come to you on the screen every time you prescribe a drug. When I made this composite slide for a call center from the National Health Service, I never in my wildest dreams imagined that I would see an advertisement in the Indian newspaper by the Department of Health and Family Welfare, Government of Delhi, asking tenders for medical call centers. Who says India is behind? And I'm told that very soon we are going to have medical call centers, triage facilities, etc. Exactly what is being done in the United States. For the last 3 months, I have been playing about with virtual home visits, and today I have done about 15. So that's not a big number, but I think sending one man to the moon is enough proof that you can send a man to the moon. We have done 15 teleconsultations now virtually. It is my dream to revive the concept of home visits. I remember 35 years ago when I just passed my MBBS, I used to make home visits, but now even a raw MBBS graduate today doesn't do it. We can do it today electronically, and we have done this here. You can see a patient after discharge. Today I can take an entire telemedicine kit to the house of an individual, convert his house into an IMC, into an ICU, and this is the future. This needs to be done. I started off my talk by saying we're talking of wellness, avoiding unnecessary cardiac surgeries, and this is the future. You're going to have kiosks like this in every mall, in every big supermarket in this country, where you test for yourself. Walmart has already started this several years ago, and then of course you join up with various organizations, and in the end you get Quaker's oats, because oats probably is supposed to reduce your cholesterol. I was talking to you about compliance and adherence. A paper published just 10 days ago shows that in the last 2 years, this company has increased its turnover 100 times. Now this is what happens. You have a glow cap. The medication caps transmit reminders over wireless, and it automatically sends a message to your neighborhood pharmacy and tells your neighborhood pharmacy that it's time for a refill for such and such with GPRS and all those things you're familiar with. It's very familiar to do this. And again, compliance and adherence are the most important things to do. 653 million mobile phones. This is 2 weeks ago, the statistics given by TRI, Telecom Regulatory Authority of India. 14 million mobile phones are sold every month. All the pundits who predicted, who drew graphs like this, have been proved to be wrong. Today the graphs have gone like this, and nobody wants to predict what is going to happen in the next couple of years. I am convinced that the mobile phone is the future for delivering health care. Now look at this. This is all from a PDA. You can look at an X-ray, you can look at a histology slide, anything you want in medicine, everything can be transmitted. These are all now available in Western countries. It's just a question of time before this comes to India. September, October, we are going to have 3G. And once we have 3G, I see no reason why we can't do this. India, unfortunately, holds the world's record in the malaria tuberculosis, National Malaria Eradication Program, tuberculosis control program. Anybody who has a cough is given anti-tuberculosis treatment. And this produces more problems because of resistance. 90% of tuberculosis diagnosed by a tuberculosis research center in Madras are resistant to the primary and secondary anti-tuberculosis drugs of therapy. We are going to have major problems. So what should we do? We should take a sputum smear. We should examine it under the microscope before diagnosing tuberculosis. Easier said than done, because we just don't have trained technologists or doctors to look under the microscope. Preparing a smear is no big deal. A school dropout can be taught how to prepare a smear. And ladies and gentlemen, for $20, the UCSF, University of California, San Francisco, have made this, and this is an ordinary mobile phone. You'll be able to pick up this and images in this. We are planning to do some trials on this to see how the mobile phone can be used. I mean, all of you know about the RSNA, a very highly respected body law. This has been quoted in a court of law. The RSNA now has approved that the iPhone, I'm not here to propagate the iPhone, any smartphone, if the medical image quality is sufficient for doctors to make an accurate diagnosis of appendicitis. Now let's look in the future. Bill Gates, I presume that Bill Gates Foundation would not part with $100,000 unless there was some possibility of this research turning out to be successful. Just imagine, cough into a phone and get a diagnosis through acoustic vocalization analysis software. Thank God I'm not going to be practicing 10 years from now, because I think doctors will really be totally redundant, unnecessary and irrelevant. Now this is the future of mHealth. The next time you are driving a car, you are an asthmatic. Technically this is feasible even today. You are an asthmatic. You can measure today the local air quality, and through GPRS we know exactly where your car is, and you will get a message like this which says that in exactly 6 minutes from now, of course this cannot apply to Bangalore. It took me 3 times the travel time to come from the airport to here than it took from my house to Bangalore, but in all normal cities, you are traveling at 70 kilometers per hour, so in exactly 6 minutes from now, you will reach such and such a place, and in that place the local air quality is 5.6, so please avoid that area, otherwise you may get into status asthmaticus. The next time you are going to park your car by the side of a Kentucky Fried Chicken or a McDonald's, you are going to get a message which says, hey look, your cholesterol and triglyceride were so much. If you go there, you are going to increase it. Why don't you go 2 kilometers away and eat salad? There is a salad joint over in that place. And who is doing this? Americans do everything. Pardon any Americans here in this audience. Ultimately, the whole world revolves around vitamin M. So insurance companies are the ones who are promoting this research. Because the insurance companies, the guy who has to pay for the bypass surgery. So the cholesterol doesn't go up in the first place. He can reduce the cost for the bypass surgery. So he is doing extensive research into these things, and this is what is going to happen. Pilot studies are already going on, and this is the future, what is going to happen. So ladies and gentlemen, real change requires real change. Most of us are afraid of the future. We cling desperately to the past, to the present, not realizing that we have already become the past. We are afraid of the future, and the future is always ahead of schedule. Things which I thought would never ever happen in my lifetime has already started happening, and if we feel that something will take 5 years to happen, I think it's going to happen in 1 year. To always deliver more than promised, I think this institution is a superb example of this. To always deliver more than promised. And again, I am very passionate about India. I am a made in India product. I've never had any education outside India, and I'm very proud of it. Information technology can be the great leveler and truly transform. We are not talking of incremental growth, which is natural. 10% growth every year, which is natural. We are talking of a radical transformation, not an incremental growth. And that can be possible only with digital healthcare, with information communication technology. We are going to bridge the so-called digital divide, the so-called health divide. And the greatest advantage which we in India have is we have no legacy system to disinfect. We do not have to follow the West. We do not have to piggyback on them. We can leapfrog. 600,000 villages in India who never ever saw a rotary dial phone today use smartphones. 15% of villages in India, so the first phone in their life which they saw was a smartphone. We don't have to embark on major unwiring projects, whereas in the West, they have to start unwiring and and then go into wireless. We will directly go into wireless. I think we are on the brink, on the threshold of a radical transformation, and it's my dream that we have 1,000 teleradiology institutions over this country, and I think that is what India requires. Not an isolated center of excellence, not an oasis in a desert, but we require hundreds of thousands of this. We can do it. The only people, and I think the people in this audience, if you can't do it, nobody else can do it. And if this talk has in some way helped you to feel that you will rise up to the challenge and ensure that India is no longer a developing country, but becomes the mecca of healthcare for the rest of the world, I think it would be a wonderful thing. Thank you very much.